Yes, good morning, Congressman Neal, Congressman Brady, and members of the Ways and Means Committee. I'm Robertson, Chief Administrator for Nebraska Farm Bureau. We are pleased today to share with you some challenges we see in the individual health insurance markets and also some steps the Nebraska Farm Bureau took to protect those Americans with pre-existing conditions. I have dedicated my entire life to help farmers and ranchers, and I just honestly couldn't believe what I saw during the summer of 2018. We held listening sessions with our farmers and rancher members, and literally they got up in tears talking about their challenges of how they're coping with the health insurance markets and the individual market. And the emotional stories were many. I mean, farmers and ranchers and spouses got up and said, you know, I am forced to work off the farm because of the high cost of health insurance. Farm and ranch families not taking out any health insurance and then having major medical bills during the year. Highest living expense for the farm is health insurance. Those stories were all over the board. We heard common reports of annual premiums being $30,000 to $35,000 to $36,000 a year. That's $3,000 a month. And I'm sure Congressman Adrian Smith heard similar stories throughout his travels in Nebraska as well. But what makes matters worse is farmers and ranchers, more than any other sector or occupation in the country, are more affected by the high cost of the individual health insurance markets than any other sector because the lion's share of farmers and ranchers are self-employed. And if you're self-employed, you generally buy on the individual market where the costs are high and you're not able to be a part of a large group. This is not a partisan issue. This is not a political issue. This is an issue of hardship. And we need to fix these individual markets and try to find some ways to protect pre-existing conditions at the same time. Because of these issues with our members, Nebraska Farm Bureau took matters in our own hands. In 2017, we began to establish an association health plan with our organization. By the fall of 2018, we implemented it and started enrollment. It never would have happened without the wonderful partnership we had with insurance carrier Medica, based out of Minneapolis, Minnesota. They partnered with us, and the plan offered a more affordable health insurance product, which on average was 25% less than the individual marketplace for members of our large group in our association health plan. It covers pre-existing conditions, and let me repeat that. It covers all members regardless of their health status in our association health plan, and it was ACA compliant. The plan is what our members wanted and is what we delivered. In creating the association health plan, we deeply believed it was imperative to cover pre-existing conditions, and that's what we did. Let me be clear, that's not an attack on the ACA, that's a companion to the ACA by providing our members with another insurance option. And our results coming out of the first year, we had almost 700 members sign up for the association health plan, saved millions of dollars in premium cost, and then we continue to hear a lot of interest this coming year for sign up for the next enrollment period starting in 2019 for the 2020 year. From a policy standpoint, one of the best ways we can do to protect Americans with pre-existing conditions is to enhance the ability of individuals to band together, pool their risk, and form large groups that are fully insured. That is what the AHP, our association health plan, did. In our case, many of our members are self-employed. The only way we're going to be able to form this association health plan was because of the new association health plan regulations issued by the Department of Labor last summer. If it wasn't for those new regulations, we would not have an association health plan for our members. Let me share a quick example with you on the impact this association health plan had with members. Our first enrollee out of the gate, husband and wife who farms together near Fairbury, Nebraska, 2018, their annual cost on the individual market was $25,000. They're told that in 2019 it was going to be $26,000 a year. Under our plan, in which they signed up, it was $19,000. They saved $7,000, and that's real money. How do we get this discount rate? You know, farmers and ranchers are now part of a large group, rated as a large group, and when you rate as a large group, you can spread the risk out, you can lower administrative costs, and you can do a little bit more with pricing in terms of risk adjustment factors. My testimony provides a lot of eligibility criteria on how to be a part of our association health plan. In general, you have to be a similar line of business to be a part of that, so we designate it and target farmers and ranchers and agribusinesses, and it is ACA compliant on what it covers. Our organization represents farmers and ranchers with an average age approaching 60. We strongly support the continuation of health plans that cover pre-existing conditions. The key is to provide innovative policy solutions to allow for those type of things like the association health plans to be a part of how we cover pre-existing conditions. Hopefully our plan works, and I appreciate the time from the committee today, and I'll be happy to answer any questions.